So today let's consider QTC interval, the effect of prolonged or elevated QTC intervals, the drugs that shouldn't be combined. If taken together, it may prolong the QTC interval, and also how the manifestation of QTC of prolonged QTC interval in patients. QTC interval is actually the time taken for the heart electrical system to repolarize and reset. The time the time taken for the heart electrical system to repolarize. That means the time taken for the heart electrical system to return to its resting membrane potentials. So drugs that prolong QTC interval may actually cause irregular heart rhythms. So when QTC interval is prolonged or elevated more than the time it should be, it may cause irregular heartbeat. Some drugs can cause prolongation or elevation of QTC interval. Example is the macrolide antibiotics. Drugs like erythromycin, clarithromycin, the azoles and the fungals like ketoconazole, fluconazole, itraconazole, antidepressants like mipramine and amitriptyline and others. Now, elevated QTC interval manifest can be very dangerous. In fact, if two drugs from these classes that I've just mentioned, maybe fluconazole and the antibiotics are combined, it can further potentiate the elongation of this interval, and this is dangerous in patients. It can manifest as seizure, palpitation, cardiac arrest, and even death. So drugs that have the potential of elongating the QTC interval should not be combined with another drug that has similar effect. Example, fluconazole and erythromycin should not be given together, should not be combined because they potentiate the elongation of this interval, and this can be dangerous to patients. It can cause seizure, palpitations, and perhaps cardiac arrest, which is deadly. So when you are giving medications, ensure that you check. This is for the medical, this is for the health personnel. When you are administering or prescribing medication, ensure that you check its effect on the QTC interval. If it has the effect of prolonging the ability of prolonging the interval, don't combine with other drugs that has similar effect. I mentioned drugs like the antibiotic class. Example is macrolide can do that. Example, the erythromycin can do that. Antidepressant example is imipramine. Amitriptyline can do it. The azoles, antifungal, ketoconazole, fluconazole, they can all prolong QTC interval. Fluoroquinolones antibiotics like the levofloxacin, ciprofloxacin can still increase or prolong the QTC interval, so it should not be combined with the above mentioned drug to prevent sudden cardiac arrest in patients. So check medications before prescribing. If you love if you don't love this, what I just said, subscribe to this channel, turn on the notification button for more videos. See you in my next video.